So my name is Natasha Zajc. I'm a family physician and a palliative care physician here in the northern section of York Region. I'm also chair of PalCare Network for York Region. We are a nonprofit organization whose mandate is to deliver high-quality education to the healthcare sector in providing top-notch palliative services. We're also a network to connect clients and families to hospices in the region. And I'm here to talk about caring for the dying individual. In my role as a palliative care physician, I often encounter situations with family members who seem extremely overwhelmed, and I try to reinforce that this could be a very special and rewarding time in caring for their loved ones. And I often try to focus on ways to help them look after themselves and also ways to make caring for their loved one a little bit easier. And hopefully this will give you some guidance as well too. So on the images I've got here, basically the pictures sort of speak loudly as to what these individuals might be experiencing. In the first image, I'm trying to emphasize the idea that a lot of times this results in the worry and the anxiety of what will happen next. Will I be able to look after this individual? This can often follow with symptoms of feeling guilt or anger or resentment. Oftentimes, this then leads to symptoms of depression and feeling extremely overwhelmed by the task at hand. And the last image is suggesting burnout, and that's the one aspect we want to avoid altogether. So in the common situation, as you often see on an air flight when you're reading the emergency brochure, the common sign of put your oxygen on first, that's the theme that I want to reinforce. So if you can look after yourself, then it'll make it easier for you to look after your loved ones. So importantly, you have to start paying attention to what you're feeling, both physically and emotionally. Are you recognizing any signs and symptoms of stress, usually associated with things like difficulties with sleep, change in your appetite, loss of interest, feeling more irritable, and also being more prone to things like flus and colds. Symptoms of burnout suggest that it's far more advanced at this point, and oftentimes family members might notice that they're suddenly experiencing no energy or wanting to sleep all the time, wanting to withdraw from those around them, isolating themselves, having more symptoms of anger or resentment, and experiencing no emotion at all. Physical aches and pains are common, and we can often see chronic conditions worsening as well too. Recognize and accept your limits. I like that OLG comment, but I kind of revise it in saying know your limits, care within it. Can you physically manage your loved one's needs, such as lifting them out of a bed or a chair? Do you yourself run into problems with chronic health conditions that could put you in harm's way by looking after them, things like heart disease or chronic lung disease? Can you financially manage this or logistically manage this if you're a single mom looking after a young family at the same time? Never assume what others know what you're feeling. Always think about asking for help. And this includes not just your family or friends, but also the healthcare team around you. If the healthcare professional is unaware of your limits, they will naturally assume that this care will be provided as they prescribe. And this can certainly be a situation that will occur when you're facing things like discharge from hospital. And this is a very critical time to be able to speak out to say this might not be as easy to do as we had hoped to do. Adjust to this new normal. I always stress with family members that the important means of coping with any type of stressor is to learn to adapt to the situation. And this new normal may be a temporary change or maybe a more permanent change. But it's also always important to reflect on the things that you were able to do before you came into this caregiving role. Was it something like exercising or playing sports? Did you belong to a particular club, like a book club? Did you attend a place of worship on a regular basis? Or did you just simply enjoy getting together with friends and family? It might require some adjustments and it might require some supports from other people, but it's important to live out these opportunities to ensure that you don't yourself experience caregiver burnout. And embrace these moments as what they represent. This is a very special time. I always reinforce with family members that this is as much of an important time as the day you were born or the day you got married. It's a time that you could easily reflect back on and certainly be grateful for the opportunities you had to share with your loved one, to be able to tell them how much you cared or loved them, or be grateful for the things that they were able to do for you. It also gives you an opportunity to reflect back on happier times and as well just to simply give back. One of the other kind of key phrases I use for family members is always hope for the best and prepare for the worst. And this is in particular when you're problem solving in how you're looking after your loved ones. We always hope that things might improve or things might turn around, but in palliative care we understand that the outcome is likely not going to be in what we'd hope for. So first and foremost, get all your facts straight. Do you understand what this illness is about? Do you understand the diagnosis? Do you have a clear understanding how things might change and the expected outcomes, or even the prognosis? Who's involved in your loved one's medical care is also key. You want to be able to know who you're going to connect with when those certain situations come up. Have you been connected with all the important healthcare providers? There may be individuals that you might not be made aware of, and this would be a time when getting a palliative care team involved would be critical, because a team would certainly be able to address all the components of whole person care, which would involve physical, emotional, and spiritual care. Discuss the goals of care. Talking about end-of-life issues is mostly uncomfortable, but in the best of times, but it is that much more important to have these discussions now at a time when your loved one might be able to express their wishes, and this also gives you an opportunity then to be able to express their goals of care to the healthcare team around you. It's important to know who to call, when to call, and where to go. When working with a team of healthcare providers, it's important to understand each individual's role and at what point do they remain involved in your loved one's care, and at what point do their role might change as your individual's health changes. When to call someone is also equally important to identify as who to contact and where to go when situations arise. Set regular appointments for your loved one. This allows you to monitor for changes and also be prepared for anything that comes unexpectedly. It's also important to have this opportunity to express to the team if you're suddenly having more challenges at home and need the added support of other healthcare providers. And I always stress to the family to create a contingency plan. Find out what's the worst case scenario. What would you do if this person is suddenly having a seizure, if they're having trouble breathing? What's the plan at this point? Oftentimes there's medications that are provided in the home, and we can turn to those things immediately to get the patients more comfortable. Or it might be a time to call for help, whether it's to call for the visiting nurse to come out to visit or a situation to call 911. Also, a contingency plan would also allow you to consider options of if things at home are not manageable, where can we go from here? Is there access to something like a hospice bed or a palliative care unit? I don't know what to say or do. That's a very common response when you're dealing with someone who's dying. It's a very isolating time for the patient, and it's very challenging for loved ones, friends and family to try and reach out. I don't know how many times I've heard from individuals who say, you know, I'd like to try to connect, but it's just very hard to try to be there. You just stumble with what can you say, what can you do. So I always try and reinforce it, just be yourself. If you're the kind of person that enjoyed time with this individual in the past, sharing jokes, sharing similar interests, that's what the person wants. They just still want to be treated much like they were before. You got to remember that they're still the same person. It's just their health that's changed. Maintain some routine. If getting out to favorite coffee shops was something that was part of your daily interactions with this, or regular interactions with this person, or watching a favorite TV show, or cheering on your favorite hockey team, those are the things that help to instill a sense of living for the individual, and it also gives them something to look forward to. Remember, you always have to allow for some adjustments because it can be a bit challenging for these individuals to either physically get out or to find time to make these things happen. Give them a sense of control. It's most common struggle for these individuals is experiencing of loss of control, both over your body and over your whole existence. Individuals might turn to things like continuously keeping notes of things. I've run into situations where they've jotted down every individual that's come by their bedside to interact with them, whether it's on a social basis or for a medical reason. And to us it might seem a little bit obsessive or a bit annoying, but it is one opportunity for them to be able to establish some sense of control over their situation. As well, consider what it means for their independence. What can you do to help support their dignity and their self-preservation? Support their feelings. Don't dismiss what they're feeling, but allow them to express themselves. It doesn't take any effort on your part except to listen. Being ill is isolating enough, and this can certainly make it much worse. Be open to the discussions about death and dying. Again, a very uncomfortable conversation, but it may be the only time that they can speak about the things that they're worried about and the things that they're fearful of. Will their family or friends know what to do for them after they die, with planning things like the funeral, handling their finances? How will they look after the family or the children or their pets? They may be fearful of the death or dying process, and this may be an opportunity for you to seek guidance from someone like a healthcare provider or someone like a spiritual advisor. Don't be afraid to touch or talk. Again, their illness is isolating enough. Connecting by speaking to them or through touch could mean more to them than anything else that goes on that day. When their condition worsens and they appear to be unresponsive, again, don't hesitate to speak or talk to them. They are still aware of their surroundings, and they can still sense your presence. And that in itself might be more comforting for them than any medication we provide. Don't be afraid to laugh. Laughter is the best medicine, and there are certainly many situations that can either lead one to get upset about it or to laugh about it. And laughter can be a great icebreaker or a great stress reliever. Reflect on the past. Share your memories. Reflecting on good times reminds them of the impact their life has had on the people around them instead of focusing on the things that they will not experience. And this reminds them of all the wonderful things they got to see and do and how it made them feel at that time. And lastly, just be present. Being present is so key. Sometimes there's nothing else than just to be there and knowing that they're not alone at that particular moment. What should I expect to see? A lot of times family members are aware that death is not far, and it can be quite a frightening experience. And it's important for them to be prepared for some of the physical things that might go on so that they aren't taken aback by what they're seeing. So the more common thing that starts to happen is oftentimes the patient becomes more withdrawn. We don't see them socializing as often, and that certainly can be for a lot of reasons. But it's typically the trajectory of how the physical condition changes. They can have fluctuating levels of consciousness. There will be very brief moments of being alert and awake in interaction. They may just open their eyes for a few minutes at a time, and then predominantly their time is spent resting peacefully. They will have difficulty swallowing, which is a normal process as the body and the brain start to lose connection with one another, and the mechanism of moving all the muscles to support swallowing becomes diminished. And as a result as well, they lose interest in eating, and they often stop drinking around the same time. And these, again, are normal processes of what happens as we die. Our body just gradually shuts down. Because we're not taking in as much, urine output is significantly reduced, and oftentimes there's patients, when we see them in a palliative care unit, for instance, catheters are often by the bedside, so we can actually monitor how much urine output is coming out. And even the color of the urine gives us a clearer idea of if we're that much closer to the end. Patients can experience bouts of confusion or experience hallucinations. Not uncommon for them to even experience things like seeing individuals that have passed away in years gone by. I've heard of individuals who've seen angels, seen staircases. And usually these hallucinations are not too disturbing, and often family members even find that a bit comforting as well too. Changes in breathing pattern, very common for them to experience long pauses as we get closer. They'll have regular breaths and then a long pause, and then it starts up again. The breathing can also change from the standpoint of some wet noises that we often describe. And as physicians, we do try to provide medication to clear the secretions that we naturally produce. It isn't a symptom that's typically distressing to the patients. It's more disturbing to us. And it's simply because the secretions are not being swallowed again because the body has forgotten how to do that. So, skin changes as well. We will see modeling of the skin to the extremities and often feel some coolness as well too. And overall, if this is done properly, the description is typically that they are just resting, they are in a peaceful state, they are not exhibiting any symptoms to suggest that they're in pain or anxious, and they just simply stop breathing. So again, the images that I'm portraying here, I just like to sort of reinforce the importance of what this time is like for individuals and for yourselves. As we talked about, touch, hand-holding, interacting in activities that made these people whole before, and certainly connecting with friends and loved ones to whatever capacity we can. I've just listed a couple of resources here. In particular, these are the 7 visiting hospices in the New York region that PalCare is connected with. I've also listed Virtual Hospice, which is an online service to provide connection for support through services throughout Canada. And they're an excellent starting point as well, too. So I'd like to thank you very much for your attention today.